Hi everybody, welcome back to my channel. I'm Nurse Carly and this is your resource for everything pregnancy, birth, postpartum, and baby care. Every new parent wants to keep their baby safe. There's one major way that parents put their new baby at risk without even realizing it, and that is the way that you put your baby to sleep. One of the first things that we teach new parents in the hospital is how to practice what is called safe sleep. You may have heard of sudden infant death syndrome, or commonly referred to as SIDS. This is a phenomenon where a newborn suddenly dies while sleeping. It is a very unfortunate event that occurs, and we know now in 2022, we have a lot of tools available and a lot of research that has guided some very important safe sleep guidelines to help us reduce the risk of SIDS for babies. The American Academy of Pediatrics, or the AAP, has recently updated their safe sleep guidelines, and I want to go over them with you so that you have all the knowledge you need for your new baby to make sure that you are putting them to sleep safely and reducing the risk of SIDS. The first way that we know to reduce the risk of SIDS is called back is best. We have learned over the years that grandma's way of putting babies to sleep, which would be on their stomach, is no longer recommended. Now we put babies flat on their back to sleep, not in an inclined position or any sort of inclined sleeper. The second thing is putting your baby on a firm sleep surface that is approved for infant sleep. We know that a soft sleep surface that is not approved for babies increases the risk of SIDS and also increases the risk of suffocation through something called rebreathing, which if you haven't heard of that, I recommend you look it up. The next thing we know is that we have to put the baby in a safe sleep environment. What this means is putting them in their crib or their own approved infant sleep space, whether that be a bassinet, a pack and play. This means not in bed with a parent. Bed sharing is not recommended by the AAP, and it is in fact shown to increase the risk of SIDS. Bed sharing is also sometimes referred to as co-sleeping, so just know that that is not a recommended practice, especially for reducing the risk of SIDS. However, room sharing with your baby is recommended. Now what this means is, again, your baby is in their own separate sleep space that's approved for infant sleep, but they are in the room with their caregiver. This is recommended up to the age of 6 months, and it is shown to reduce the risk of SIDS. Another way to reduce the risk of SIDS is by breastfeeding. We know that breastfed babies have a reduced risk of SIDS versus formula-fed infants, and any amount of breast milk given in the first 2 months is shown to have a significant reduction of risk. So just remember, even if you are combo feeding, meaning giving formula and breast milk, that breast milk that you are giving is beneficial. Another recommendation is putting your baby to sleep using a pacifier. Even if they don't routinely use a pacifier during the daytime, try to put them down to sleep with a pacifier when they are taking a nap or sleeping at night. This is shown to reduce the risk of SIDS. When you put them in the crib, there should be nothing else in the crib. We're not giving stuffed animals, no loveys, no blankets. We're not using padded side rails. It is a bare, boring crib. You want to avoid any exposure from the parent and baby to nicotine, marijuana, any sort of illicit drugs, alcohol, sedatives, anything like that. You want to avoid the use of anything that's marketed as a sleep product, like a wedge or a lounger. Again, nothing should be in the crib with your baby. Just the baby in the crib with a pacifier. Pacifiers are allowed as the only object in the crib. You can choose to have your baby swaddled or not, but if they are not swaddled, there should not be a blanket. Make sure that your baby is up to date on their routine immunizations, aka vaccines. The AAP does also recommend tummy time for helping your baby to strengthen important muscles that are going to be needed for all sorts of things. Tummy time is placing your unswaddled baby on their tummy, on the ground, and doing this for at least several minutes per day, starting from the time you get home from the hospital and moving up to about 15 minutes per day by 7 weeks old. So that pretty much covers everything you need to know about how to put your baby to sleep in the safest way possible to reduce the risk of SIDS. If you guys have any questions, please leave them in the comments and I will respond. If you like this video, make sure to like and subscribe to Nurse Carly for more content like this. Thanks for watching.